we need to talk about a headline that reads like a typo.
It's not a typo. Colorectal cancer is now the leading cause of cancer death for men under 50 in the U.S.
How does a disease of retirees become a young man's problem?
Since 1991, cancer care has saved 4.8 million lives in the U.S. Early-onset colorectal cancer is trending the opposite way.
So medicine is winning and also losing.
Or we're counting differently. That's the fight. Real epidemic versus detection artifact.
Either way, the unease is real.
The vibes are irrelevant. What matters, what people do this week, and what public health does next year. Early-onset colorectal cancer is rising 1 to 2% annually since the mid-2000s, even as older groups improve.
This is the modern kind of terror. Good news with a catch.
Precision. That #1 killer line is cleanest for men under 50. For women under 50, breast cancer still leads.
In other words, the story is serious enough. We don't need to inflate it.
Birth cohort data. People born around 1990 have double the colon cancer risk of those born in 1950. Rectal cancer, 4 times higher.
That's not a random spike. That's an environmental fingerprint.
Here's the skeptical case. If incidence rises faster than mortality, screening and better imaging can create an epidemic of diagnosis.
Like cleaning your windows and realizing everyone saw the mess all along.
The Pro-Epidemic case. Some analyses show mortality rising too in younger adults, and the pattern shows up across multiple countries with different healthcare systems.
Translation: you can't blame American billing codes for South Korea. The tragedy is how boring the early symptoms can be.
Blood in stool, persistent changes in bowel habits, unexplained weight loss, fatigue, symptoms people dismiss, and clinicians sometimes dismiss because you're too young.
Which is emotionally efficient and medically disastrous.
Obesity is consistently associated with higher colorectal cancer risk. Rates of obesity rose in the same generations where early-onset cancers are rising.
The problem with obvious suspects is they're rarely alone at the scene.
There's a microbiome hypothesis. Early life exposures, diet, antibiotics, shift gut bacteria. Some E. coli strains produce a DNA-damaging toxin called colibactin.
Like discovering your gut roommates have been rearranging the furniture with a hammer. A lot of this points back to one theme. We've industrialized eating.
Processed meat is a known carcinogen, but diet data is messy. Processed covers many foods, and correlation isn't conviction.
The court is adjourned, but everyone's still a suspect.
Microplastics have been detected in human stool. A small study of 8 people found them in every sample.
Comforting, at least, in the sense that we're all doomed equally.
Microplastics have been found in colorectal tumors. One study detected them in all 50 samples tested. Animal and mechanistic studies suggest they can promote tumor growth.
But
in humans, we do not have clinical evidence proving microplastics cause cancer. There's a strong, plausible, alarming, unproven label on this.
the scientific version of you should worry, but responsibly.
Current U.S. baseline. The USPSTF recommends starting average risk colorectal screening at 45.
A number that sounds young until you actually meet a 45-year-old.
Debate. Push screening to 40, or focus on the bigger win. The many people 50 to 75 who've never been screened.
The moral math is brutal. Chase a smaller, rising problem, or plug the giant hole in the boat.
Screening is also a financial decision. Follow-up colonoscopy after a positive test has historically triggered cost-sharing for some U.S. patients.
Because nothing says public health quite like a surprise bill.
Medicare is phasing out that cost-sharing, with full coverage by 2030. Private insurance is messier.
So even when we know the right thing, we treat it like a luxury.
What we know. Early-onset colorectal cancer rates are rising. The birth cohort patterns suggest environmental or lifestyle exposures. Multiple plausible mechanisms exist.
What we don't know is simpler. The single villain. there may not be one.
And that's why the episode isn't, here's the cause. It's, here's how to think without being manipulated by fear.
I can't shake it. This feels like our body fighting back. We optimized for convenience, then act surprised when it pushes back.
Treat it as a data and action problem. Know your symptoms and family history. Screen if eligible. Public health. Fix access barriers before moving the age line.
In other words, less panic, more planning.
That is our show. This has been MAI Take on This. Stay curious, stay critical. See you next time.
This is my take on this. Spinning and spin, give it a twist. We turn your mid, I must admit. My take on this, oh yeah. Right hard mess with a perfect quip. Every side, we side-eye it. My take on this. You say breaking, I say broken. You want fact, you call it serious, I call it show. We dress it up in questions that the punchlines glow. This is my take on this. Spinning the spin, give it a twist. We turn your mid, I must admit. My take on this, oh yeah. Right hard mess with a perfect clip. Every side, we side-eye it. My take on this. Make up your mind, ask what you find. Is it truth or a skip? Crowd, hey, I. Be your guide through the glitch and make it smart, make it slick. Hey, argue, agree, double check it. You bring drama, I bring drama. You call law, I call my mama. You say sources, I say tea. Somewhere in the middle is the bit we let you see. This is my take on this. Spin the spin, give it a twist. We turn your mid, I must admit. My take on this. Hey, hey. Right hard mess with a perfect quip. Every side, we side-eye it. My take on this. Ticket scrolling fast. Giant voices in the cloud. Little world inside a frame. Big opinions, tiny fame. Lifeline. Cut to break. Flip the back and on the same mistake. We're right. Maybe we're right. Always ask twice. In the glare and the grid. Make a mess, make it hard. Angle it sharp. Aim at the heart. In between jest and the gist, that's our my take on this. So what's your take? Same old fun, brand new fun. Tune in, lean in, laugh and breeze it. 'Cause you got your take and we've got my take on this. Hey, my take on this. Hey, 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 hey. My take on this.